Thank you for joining this webinar that we are talking about mental health at the workplace. And our speakers are going to be Dr. Simon Njuguna, who is a consultant psychiatrist at the Mathare National Teaching and Referral Hospital. We have seen him a lot in this platform. He provides strategic leadership in health systems, strengthening and continuous quality improvement. He's also just the other day he's been in the mental health division as the director, and he also provides training and mentorship to healthcare workers and medical trainees to build on their competencies and professional development. And he's also he has a keen interest in advancing better mental health outcomes and human rights orientation practices in mental health services. He has led many initiatives in the implementation of mental health policy and shared tremendous achievements in the journey of the transforming the mental health landscape in Kenya, and I think across the mental health world. He's very influential in that case, and he's very passionate about mental health. Our other presenter is Madam Mary Mwangi. She's a mental health nurse, also working at the Mathare National Teaching and Referral Hospital. She has worked in Mathare for some time, which has enabled her to develop some rich experience and expertise, especially when it comes to mental health at the workplace. So she has both the lived experience and also that she has been able to see from other areas. So we are going to begin. I'm going to be your moderator, and we're going to begin by just a bit of house rules. If you have a question, you can put it in the chat so that once the discussion is the discussions are done, then we will be able to answer them. You can also, you can all, if you have any of those questions, then you can be able to ask, and we are going to be answering them if we have questions. And what Nelson did not mention is that this is normally a CPD point webinar, and you are eligible for the same. And most of the time we follow up on the same, but most of the time Kenyatta does that for us. Thank you very much, and I'm going to invite Dr. Njuguna to begin with the presentation. Daktari, karibu.
So thank you, Melvis, for introducing this webinar for today. And also like to welcome all the participants for joining. We'll be discussing this very important topic for the next 1.5 hours. And this is coming at a time when the World Mental Health Day celebration for this year, the theme is mental health at work. The World Mental Health Day will be commemorated on 10th of October. That's the day after tomorrow. And with that, it's very important we can have this discussion today. Mavis, you can put the presentation on full screen. Mavis, at the bottom of your computer, you can do that.
Yes, actually, I'm doing it. I'm doing that just right now.
So the discussion around mental health at the workplace is of such importance because as human beings, we spend most of our time at work. And with this regard, it has been found that it's one of the key strategy in addressing issues of mental health that we need to focus at the workplace. As I'm waiting for Mavis to do that, there you are. You can do it now. Good. So the outline of my presentation today, we'll be looking at the theme of this year, World Mental Health Day. I'll also discuss about the objective of the World Mental Health Day. This is an annual event commemorated worldwide. I'll also discuss around why mental wellness at work, why are we discussing these aspect about mental wellness at the place of work? And discussing that, we look at the facts on mental health at the workplace. We look at the socioeconomic impact, and also we look at how worthy it is. Is there any returns on investing on mental health at the workplace? The third area of discussion would focus on the guidelines on the mental wellness at the workplace. We do have the national guidelines on mental wellness at the workplace. And I take this opportunity to briefly mention about the strategic approach, which are recommended in those guidelines, and also the guidance on establishing a workplace mental wellness program, which is also you can find in that document. But then also it will be very important to understand the emerging issues around the modern workplace, because with that understanding, you'll be able to establish a relevant mental wellness program with that consideration. And lastly, I have to talk about Mathare National Teaching and Referral Hospital. This is government parastatal where I work, and it has a key role to play when it comes to mental wellness within this country. Next slide. So the World Mental Health Day 2024, as I mentioned, the theme will be mental health at the work. If you realize we are using the word at work because this day work may be virtual, maybe hybrid system of work, so it doesn't have to be on a physical location. The objective of the World Mental Health Day is to raise awareness on mental health at work, but also to mobilize efforts in support of mental health at work. So that's why worldwide, the World Health Organization has dedicated the 10th of October this year to address these two objectives. First is to raise awareness, and then is to see how we can mobilize effort from all parties involved at work to see that we are able to get mental wellness at the workplace. And if you look at some of those, before you go to the next slide, you look at those promotional materials I've shared with you there. Very clearly, they are saying, with so much of the day spent at work, it's crucial that work promotes and protects mental health. The second one, look at that we spend so much time at work. There comes the issues of job insecurity and safe condition, work overall discrimination. And the poster says that these aren't just workplace issues, they are mental health risk. So some of these issues we encounter at our places of work, we may not consider them as mental health risk. But what we are saying today and what we want to communicate to you, these issues we go through on day to day when you are working in our places of work, they may constitute what we call mental health risks. And the third poster there, as you're seeing someone raising their hands, they are saying that if you have a decent work and a healthy working environment, then it can be protective of your mental well-being. So it brings two dimensions that at a place of work, there could be mental health risk, but also we can put our places of work in a way that it may protect our mental health. And so there's a call there as attention to employers that supporting mental health will improve your team well-being, and it's the best thing to do because it will increase productivity. See the next slide. So why mental wellness at work? Again, just like I've mentioned in those 4 posters, 60% of the world population is at any time at work, whichever form of work they are engaged in. Another fact is that safe and healthy environment at work is a fundamental right. It's a right for you to have a safe and healthy environment wherever you're working. Another fact is that decent work is good for mental health. And there are many research findings which give evidence to this, that if you have a decent work environment, then your mental health state to be environment increases your mental health disorder. Billion work activities or the economic burden, which may result from poor mental health at the workplace. And this will come due to lost productivity, due to lost working hours because of people are experiencing anxiety or depression. Again, not looking at the economic burden, we look at individual level. mental health may affect people's self-confidence, satisfaction. Are they able to interact well and be able to have some job satisfaction? Beyond the individual, when you look at the general work environment and the society, there are lots of productivity. There's a socioeconomic development impact. And again, also, we need to look at the issue of stigma and discrimination. They may prevent people from seeking help or actually finding job, or are some of the reasons why we need to take serious the issue of mental health at the workplace. Let's go to the next slide. So this slide is derived from a study which conducted in this country in the year 2020, Kenya Mental Health Investment Case. And what we tried to do is to look at the socioeconomic impact of mental health in general. But this slide is found out from our study was that 49, what we did is we looked at the prevalence of mental health condition within the workplace, and then we converted this in terms of the economic burden. And we looked 9% of the economic burden related to mental health at work was due to absenteeism. So what it means is that people are not able to attend to their work because of various issues related to their mental health. 30% were people who are able to be at their places of work, but they were not fully contributing to their work goals. So they were not fully productive because they were struggling with one or the other form of mental health problems. And then further, we found that 12% of the economic burden or the economic loss is due to prematurity death. People who may, because of mental health problems, may lose their life or may live a shorter life as a result of their mental health problem. So there are a number of man hours within their working life which are lost. And only 9% of the economic burden or the economic burden which was related to the expenditure in terms of healthcare cost. And in overall, this costed about 62.2 billion Kenya shillings, which is about 0.6% of the GDP in the year 2020. So what does this study, what were some of the conclusions we found from this study? Was that investing in people's mental health would cost less in terms of the economic, the burden into the economic cost or the economic burden was only 9% as related for people seeking help. If we put prevention, promotion, and care and support mechanisms, we would be able to save 91% of the losses people were encountering when they didn't address issues of mental health. Next slide. Further, within these studies, we also looked at if you were to do any form of intervention, how much money would it cost to address issues of mental health? And actually here we are looking more specific on like treatment and one or two public health intervention. You may not see all the details within that diagram, but what we found out was it required about 81.7 billion Kenya shillings over a period of 10 years to address issues of mental health. But when you looked at the resulting productivity and social value of health arising from that investment, it was coming up to 161.6 billion. So if you do your mathematics, it looks like the much money you put to address issues of mental health at the workplace and the returns in terms of people being more productive and being more healthy, it was giving a return of investment of 2.1. You just do simple calculation, 161.6 billion divided by 81.7 and gives, that's the return. If you go into the details about that study, you'd see what were the returns for the different conditions, whether it was anxiety, depression, substance and alcohol use disorder, and also public health interventions, which we did put into calculation. So basically what I'm saying, and this is very important when you are using it as an advocacy tool, if you are to engage your top leadership, this is a very important study you can quote and say, yes, we want to have in place a mental wellness program, and you'll spend this amount of money, but these are what you'll get in returns. Because most of the time people like hearing about things in terms of money, finances. You can speak better with this kind of language where you are using money to argue your case. And so this is a study done in this country, and it's available. You can find this document within our website, the Ministry of Health website, and you can use it as an advocacy tool to argue your case. Next slide. So now I will go to the actual guidelines. In the year 2023, the Ministry of Health launched these national guidelines on workplace mental wellness. They are well aligned with the WHO guidance on the mental health at the workplace. And let's go to the next slide. We look at the actual guidance. So these guidelines gives the specific strategic approach to a healthy working environment. And there are three key strategy or strategic approach. The aspect of promotion, prevention, support, and care. And I'll go into the details of what of these area strategic approaches, what it entails. First, I need to emphasize, if you are setting up a workplace wellness program, the approach should be on people's wellness. It should not be the focus on people who are having mental health problems and now they are seeking for care, or you need to address how you can accommodate them when it comes to their for them in terms of their ability to work, which has been the approach most people have employed over a long time. That you set up a workplace and wellness program, and you wait for people to be unwell, and that's the only time you address their issue. It should be having what we call the universal interventions, which they are cutting across to every employee, including the employers, to maintain a mentally healthy environment. It should be proactively trying to address issues of mental health hazards and trying to maintain an environment so that you can prevent people from getting mental health problems. And then there will obviously be a small percentage of people who may require the care and support, but that should not be the key focus of the program. So having mentioned that, I think that's very easy for any organization who want to start a mental health program, that should be your strategic approach. Emphasize on promotion, prevention, support, and care. To be able to address these three strategic approach, it's very important to understand what we call the work dynamics. But at any place where we are working, the work dynamics is how it's structured, and the systems, the work system and structure may contribute to what we are calling the work-related mental health risk. And also, if it's well structured and the system are where they are more aligned to mental wellness, then you'll be more protective. And I mentioned some few things. When we are place of work, there what we normally call the work content. And here we look at the value of the work, whether the people have the skill to handle the work content. And sometimes also may have people who may have more skills than the work available or the content of the work available. And this is what generally contribute to what we call work satisfaction. There's the aspect about the workload. The workload could be an overload, there could be an underload in terms of the work load. Then there is the pace of work. We need to look at that. That is the work, the amount of work which need to be done, the content of work, and how much time factor does it require to address that work. That's very important. And that now brings the other aspect of work dynamics, scheduling of work. If we are able to understand the work content, the workload, the work pacing, then how should we schedule this work to work within the goals we want to to achieve. And so there could be a situation where the work is done in shift, work is very unpredictable, work is done in long hours. So there'll be all these dynamics which we always need to put in consideration. Then there is the issue of the work control. Work control is another dynamic of work which looks at how decisions are made, the interpersonal and communication interplay within that work environment. Because when you're working many parties and many parts. So how it's like an orchestra. So how is this orchestra conducted? Now, that's a very important dynamic when it comes to work. Then there's the environment. And these days, when you're talking about a work environment, it's not just a space. It's about even the virtual. It's not about the physical space. It could be a physical, virtual space, the technology, equipment, and all the other aspect about that space. How conducive is it? We need to think about organization structure in terms of how the policies and the systems addresses issues of roles and responsibility, the organization culture, the leadership and management systems. Then there's the human resource or the human capital, which is a big factor when it comes to work. These are the resource which is coming into interplay with all these other work dynamics. So we need to look at it, the human capital in terms of professional development, issues around how competent that human capital is it. And then there is the human capital. We know they come from a family and a community. That interface between that human capital with their family and the community. So when we understand these dynamics, then we are able to see what do we put in place when it comes to promotion, to prevention, and support and care. For this to work, as I said, like it's an orchestra, there are three players who must work in a collaborative and in a very synchronized way. There is the organization, there is the managers and individual. And I want to emphasize here because sometimes we say individual and the manager. The manager is also an individual at his own level. So everyone is an individual, whether you are the top leadership of the organization. And so you play the role of individual. And now there are times you don't play the role of an individual. You are a manager to someone else or a supervisor to someone else. Or you could be, you are the top leadership of the organization. So those are dynamics, and they are very important to understand these strategic approaches so that you can be able to set the right mental awareness program at the place of work. We go to the next slide. Okay, go back one slide. I need to mention one thing more, which is not in the slide. So when we are setting strategic actions, there must be, what are the strategic actions to be done by an individual when it comes to promotion, the managers or supervisor and the organization. And they are in a continuous spectrum. You find there are areas where they overlap and where people play different roles. When we come as an individual, in terms of promotion, the aspect about self-care and the work-life balance is very important. When it comes to whoever is providing that space of supervision, they must be able to promote and provide opportunity for mental wellness promotion. They must also be able to provide the resources. When it comes to the organization, it must be able to set that environment and provide the necessary policy and guidelines and resources to do this. So you can see I wanted to emphasize that very much. So let's go to the next slide. These are just a few examples. Let's now come to the last slide or the next slide. How within our national guideline, they have put 6 steps any organization within this country can use to set up a workplace wellness program. And they are very clear. And if you follow these, you'll be able to achieve a very satisfactory wellness program. The first one is establishing obtaining leadership support and commitment. So there must be the stewardship from the top leadership of the organization, because they are the ones who will be able to approve for the policy, the resources, and any other support required for this program to work effectively. After able to obtain that support and commitment, then the step 2 is to have a team which will lead and be able to provide day-to-day management of this wellness program. So a disciplinary team is put in place. And here I like emphasizing this team should be a team to address issues of mental wellness. Majority of the time, people tend to assume is like one of the function of the human resource department. And sometimes that's not the case. It should be able to be a team addressing the wellness with people with the necessary competencies to address that aspect of wellness. The third step, you must have a policy in place. The policy will provide the organization direction in terms of addressing this wellness and the key strategy they need to use. So there must be a written document which provide the strategic direction on your wellness program. This becomes the reference point for each and every person within the organization to know what does their wellness program, what are the key priorities within their wellness program, what are the directives when it comes to the wellness program within the organization. So there must be that. Sorry, there was a small disruption in my phone. So once you set the policy in place, then the committee should be able to come up with a costed work plan, and they get the necessary resources they need. The work plan must be able to have what are the key activities to address issues of promotion, what are the key activities to address issues of prevention, and what are the key activities when it comes to support and care in case someone has a mental health problem. And then they should be able to define who undertake the different roles. They should also have within their plan a monitoring and evaluation framework that they should be able to see they are achieving their target when it comes to mental health promotion, they are achieving their target when it comes to prevention, and they are adequately addressing issues of care and support. The last thing is to put in place to operationalize the wellness program and continuously monitor and evaluate and improve on it. So those are the key steps in establishing a wellness program. So next slide. So something also, when it comes to the work dynamics, there are emerging issues in the modern workspace. I talked about technological automation, issues of artificial intelligence and machine learning, issues of diversity, equity and inclusion, globalization, skill set, creativity and solution, climate change. So these are also things you need to put in consideration when you're setting key priorities and activities in your wellness program. I will not take too much time on that. Next slide. So briefly allow me to speak about Mathare National Teaching and Referral Hospital, where I work, and I thought it's very important to take this opportunity to training within the hospital. Let's see the next slide. Mathare Hospital will be launching its strategic plan during this World Mental Health Day commemoration on Thursday. And this is an effort of transforming the institution. Currently, Mathare Hospital is a parastatal, is a semi-autonomous institution with focus to providing high specialized mental health services, training, and research. And I've listed some of the services which are there. So we are striving as Mathare to be a beacon of excellence, training and research. The reason why I decided to put these slides is people can see where we are moving as the hospital. And when it comes to this workplace mental awareness will have a big role to play, because we should be able to provide the necessary technical assistance this kind of a program. We are there to train some of the highly competent mental health professionals, and then we are also ready to provide any support when it comes to research. Mathare Hospital, we want to move away from the aspect of what we call the revolving door phenomenon, where patients go through a continuous cycle of institutionalization. So Mathare want to focus itself on a number of things, provide high specialized services like psychiatric emergency services, addiction psychiatry, psychotherapy services, child and adolescent, neurorehabilitation, telemental health services, geriatric services. Where would the other people who require primary health care get their mental health services? Currently in this country, across all counties, there are mental health services, and so we would encourage people to seek services within those facilities, within their counties, within other hospitals where they provide integrated care. And then we can give the chance to Mathare Hospital to become a national parastatal with focus on highly specialized mental health services, training and research. I think I'll stop there. Thank you for your audience. And later on, I'll be willing to receive your questions or your comment. Back to you, Melphis.
Thank you, Dr. very much for that presentation. I think we can give Dr. some flowers and one for doing a good job. And Dr. I would like you to take a question that is here as I prepare Mary to come in. The question is, as a manager, how can I help a staff member with alcohol use addiction who has relapsed after 3 rehabilitation sessions? Thank you. So that is Dr.'s question as we continue, because you've seen we do addiction psychiatry. I think Dr. you could take that. Thank you.
So that's a very good question. There are a number of ways which we can address some of these problems. Here we are talking of someone already with a mental health problem at the workplace, and approach or the strategic arm of care and support. So as an institution, we also, within the committee, will have people we call mental awareness champion. So within the care and support directive of priority action, it should have very clear system of what can be done if someone has a problem. That this is where they will seek care. This is how we will support them to go and seek care. This is how we will support them when they are coming back from receiving their medical care, their return and integration program, how we can give them reasonable working accommodation, how we can have them be included, how we don't stigmatize them. So this wellness program, as I mentioned, we start from the policy. So it have very specific broad directives on what need to be done. Then when it comes to the plan, the wellness program plan, which you can do 5-year plan or 3-year plan, it sets very clear instructions and action. When it comes promotion, this is what we do within this timeline. These are the people responsible. These are the resources. That's why we say the costed work plan. When it comes to care, if the care says that we have an insurance which provides services for even someone with substance use disorder, then this is where they seek care. This is a person who should be able to ensure that they get the care, they are able to get back to work, and they have the necessary follow-up. So these things must be written down very clearly within our document, so that now the effort of the manager is that this manager also within their interpersonal skills, they are able to engage and be able to communicate.
Dr. you have muted yourself. Okay, thank you, Dr. Thank you very much for the answer. Thank you, everyone. We are going to usher in Mary. And just to add onto what Dr. said, addiction is a mental illness, is a brain disorder. And so the relapse, whether it's alcohol or any form, and so it becomes part of the cycle. I'm going to usher in Mary to be able to.
So Melphis, before Mary come in, let me try to address that question. The issue of care and support should be well stipulated within the action plan and the policy. Who should take what role? What should we do? Mandatory process by all the employees and the management. then the manager should be able to also have the skills, and that's why they also require some form of training to understand these issues around mental wellness, how they can have interpersonal skills, how they can support. So there's also a lot of element about even training people on how to address these issues without any form of stigma or discrimination.
Thank you, Daktari. So we will allow Mary to present so that we can continue. Mary is one of the members of the Workplace Wellness Committee, and so her presentation will heavily rely on that. Karibu sana, Mary. You take it up.
Okay, good evening, everyone. As you have heard, my name is Mary Mwangi. I am a mental health nurse working in Mathare, and I am also working in the continuous medical education department, whereby we do mentor students who come there for their practicum for quite some time, for more than 23 years. And working in Mathare, I've really learned a lot, and I've also been, Mathare has really helped me to be who I am and to be where I am. If I may say a short history of myself, I think I came to Mathare in the year 2001 when I was a little girl. In fact, I delivered just my firstborn. And so I was so naive, if I may say. And coming to Mathare, that time, the Mathare of that time is not the same it is today, and different from that time. And I remember once I was deployed in a ward that was Ward 2 female. I think it was the one of the worst ward to say at that particular moment, because I could remember some of the staffs were asking me, why have you been taken to that ward? And mind you, I was quite new in Mathare Hospital. And so when I reported to that ward, things were like, I got the team that we were working with there, they really helped me to be able to manage those patients that I met there. So we were working as a team, and me, I even never saw that workload that was being told that there's a lot of work, the ward it's the worst ward. I came to like the ward, and in fact, I worked for that ward for 7 good years, and I never regretted. And being in that ward, I also had to, when I reported to Mathare, I had my basic training. So I also did my upgrading. I did upgrading, and also I got a chance even to do my higher diploma in psychiatry. And up to this moment, I can say that Mathare has really helped me to be where I am. So Memphis, I would kindly request that you share the slides so that I can continue. So I'm going to talk on employees' wellness in workplace, and this refers to initiatives and programs that are designed to support physical, social, and psychological well-being of employees, which is critical due to emotionally demanding nature of their work, and more so in a psychiatric setup due to the nature of patients that they do care for. This effective support to employees can prevent burnout, reduce stress, and improve overall job satisfaction, which also in turn improve patients' care and also increase the productivity. And we find that if employees are less supported well, and cases, we find that there will be reduced cases of absenteeism and also presenteeism, as the doctor has already elaborated what is about presenteeism, staffs being there, but they are not delivering anything. So also by supporting the employees, there will be increased productivity. Maybe we go to the next slide. And now we are going to share on how these employees can be supported so that they can be productive in their workplace. And first is the employees, just like the patients, they should have access to therapists. Employees should have access to counselors and psychologists for regular sessions. This will help employees process the emotional toll of working in a high-stress environment. Because if employees do continue work in those stressful environments, and then they do not seek they do not seek counseling sessions, they are also going to be stressed, and also they can also get sick. Then they're supposed to be having debriefing after critical incidences. The debriefing sessions should be done to employees where they can express their feelings and receive psychological support. And then we have peer support, creating peer support groups where employees can share experiences and learn coping strategies from each other. Here I will give kudos to women, because women are known to be having their groups whereby they do share their issues, and rarely you'll get women being stressed out because they find times to share with each other. Maybe we go to the next slide. Then also we gonna do mentorship programs. In any organization, we find that there are employees who have experiences in their workplace, and then we find the other employees who are newly employed and they do not have experiences in the workplace. So those new staffs, they should be paired with more experienced staff for guidance and emotional support, helping them to navigate pressure of their roles. Then also we should have work-life balance. The management should provide employees with a flexible work schedule to prevent overworking and offer opportunities to rest and recharge. So employees who are working, let's say evening shift, that is from 7:30, and others do leave up to 5 p.m. At least something should be done so that at least they also have flexible work shift, so that at least they can also be able to go and cater for their issues. And more so, especially those who are working from Mondays to Fridays, we find that they have other issues. Maybe they want to go to attend to the official, during the official hours, and we know that the government offices do close for that, you'll find there. So if the employees are allowed to maybe leave sometimes early so that they can go and attend to their issues, they can also balance their work-life balance. Also allowing staff to have off days and leave to attend to their personal issues. Staff should be allowed to take their leaves. There's no one staff should be allowed to go for 1 year without going for leave. We also have a social life to attend to, so it is crucial for staffs to be going for offs and leaves. Create time for yourself, your family, spouse, and children. We find that most of the times we are in our workplace, so if we do not create time for our children and our spouses, also our families may not be stable. So it is good to create time and have leisure. Should create hobbies like swimming and dancing. Then also you should embrace your family, because when you are off duty, the time that you spend with your families, when you're off duty, it's good to create time for your families. So we go to the next slide. Then staff should be trained on stress management and emotional resilience. Managers should encourage staff to attend seminars and training on stress management, emotional resilience, and self-care. This will enable staff to handle the emotional intensity of their work, and also recognition and acknowledgement of employees at workplace. The organization of the managers should publicly recognize employees for their hard work and achievement, and that which can boost their morale, and hence they also feel appreciated. Some of the managers, they just look on the mistakes or what has not been done, but when things are good, they'll never even call someone to acknowledge. They just look on the fault. It should not be that way in order to boost their staff morale. Then I think the last one is supervision and leadership support. Yes, the supervisors should have regular check-in with the staffs to assess their well-being and offer support when needed. And they should avoid gossip and hearsays. Here, the managers should be going loud in the workplace so that at least they can see how the staffs are faring on. And in that doing, they'll also be able to identify those staffs who have issues, rather than sticking in the office and waiting maybe to be brought hearsays and the gossip. Also create open communication channels where employees are free to air their views without fear of being victimized. The employees should be allowed to communicate freely, because by communicating freely, they are able to share their views and even express their dissatisfaction, rather than maybe when they speak out, you find that they are being victimized. So, and that one will also affect their mental well-being. Maybe kuna another slide. Okay, safe working environment. I think this one also Dr. Lee talked about it. Safe working environment also will boost your mental capacity. Management should identify and mitigate workplace stressors such as understaffing and unsafe working conditions that could negatively impact employees' mental health. Also, conflict resolution mechanism. Employees should have access to resources and processes to address conflict or grievances within their workplace. Maybe. Thank you. It's not on the slide, but Mathare Fraternity and the management of Mathare has been so good in supporting our people, and especially those who are living with addiction, or those who are fighting addiction. We have had instances where we have staffs who are free of charge. We help them either in the Mathare Rehabilitation Center or a private one. And that one is a kudos to the management of Mathare Hospital. Also, staffs who are living with their families, the children who are mentally handicapped, and others who have physical illness and chronic illnesses. Those staffs have staff quarters within the Mathare Hospital, and also they have the work schedule. They have a flexible work schedule whereby sometimes they are given times to go and care for their family members who have those issues. Then also we have got instances whereby all staffs who are willing to go back to school to specialize maybe in mental health or any other specialty within Mathare Hospital, they have been accorded that time to go and specialize in the areas of their specialty. And we have seen other staff who have been also sponsored, like the Camille organization has sponsored several nurses who have gone to do higher diploma in psychiatry and mental health. Supporting the employees in the workplace will improve their mental capacity and their mental capability, hence increasing the productivity and patient satisfaction. Thank you.
Thank you very much, Mary. That was a great presentation of some of the snippets that can be found in our employee workplace wellness policy that Dr. Njuguna has really talked about. First, to have the policy, and then you can come up with the nitty-gritties of the things that you want to implement. So we could give Mary a clap. It's not easy to come and present. And so when someone has done that, then we give them flowers, claps, money if you can, as we continue. And I'm going to usher in my colleague, Diana, to be able to take up on the questions and up to the end of the program. I can see participants raising their hands, but I am not sure. Nelson, how can we be able to take the questions from those who have raised hands so that Diana can proceed up to the end? Diana, welcome.
Thank you, Mathis. I'll briefly go through some of the questions that have been asked. I know Dr. Njuguna has answered, and also Mathis, you've answered the first question. Maybe Dr. Njuguna, you could take this one. How can we incorporate self-care practices and mental health awareness into daily routines and policies of our workplace?
So Dan, I'll pick 2 or 3 questions and then I can respond. There's that one on self-care, how it can be incorporated in a daily routine.
Okay, and also someone is asking, we have employees who work in busy facilities alone and end up with burnout, but at a time a supervisor comes and harasses them, can this result in mental health? Thank you to Melvin, who is saying Mathare 2 has changed me while doing the practicum. Thank you very much. And then also the last question, how should we incorporate mental wellness in the workplace being in a toxic arena? Maybe you can take those ones, Daktari, and then we can.
Yeah, so thank you, participant, for a very good question. The first one is how we can incorporate self-care in as part of our daily routine. It's true, as I talked, that there are 3 strategic approaches when it comes to mental wellness at the workplace: promotion, prevention, and care and support. And I mentioned that our emphasis should be on prevention and promotion. This is contrary to the current existing scenario where workplace wellness programs are more focusing on people when they are unwell. We want to have a shift from addressing ill health to promoting. So when it comes to self-care, which depending on which dimension you look at it, it may be the 5 or the 8 dimension, we should have it as a daily routine. And this would apply to all individuals within the organization, whether they are the top leadership, whether they are the employee, whether they are the managers and supervisor, because themselves, they are also individual, even if they are playing the other roles. So a good program within the policy should be able to have those key pillars and give specific directive how they want to do with each pillar. And then every year or every 3 years, depending on how an organization depends to come up with their strategic plan. They may have a strategic plan for 3 years and then they do annual plans. They must have specific activity which are within the program of work of that institutions, which have to do with their promotion. So they must be proactive, that people are having these activities to do with the self-care. And self-care has different elements. There's a self-care when it comes to financial awareness. There's a self-care when it comes to your emotional awareness. There's self-care when it comes to your social awareness. So these things in a very systematic way, from training people to have the literacy, because when we deal with issues of mental health, we first say that literacy is powerful. People having the information and understanding is the best investment in people, because it empowers them to understand and then to know what to do and where they can seek for care. So I think that one I need to emphasize as that much. Then you mentioned about a busy facility where there is burnout and all that. Then these an area already having what we call mental health hazard. And so the committee in one of its plan, especially when they are coming up with a policy, they need to do a situational analysis. Whatever program they are coming up with must be informed by evidence. And so we encourage them to undertake survey to be able to pick what are the mental health hazards. And as I mentioned, the work dynamics, it could be the work scheduling, the work content, the work load, the work pacing, the environment. Then they are able to pick those hazards, and then they bring them to the entire institution that this is what we have picked, these are the gaps, this is what we need to do, these are the resources. So it's just like the way we do any other plan when you're addressing the various aspects we deal with. So this committee, one of their responsibilities is like their day-to-day work. They're able to identify the issues, they are able to come up with solutions, they are able to monitor and evaluate. I think I've answered that. And the same thing even when we say toxic, when we mentioned around the issues of what a manager does, what the organization does, what the individual does, and all of them complement each other and overlap, and they must work together. So if you have the toxic supervisor, he could be costing too much to that organization. So he need to be, the focus should be on that hazard. That individual is a mental health hazard. And there must be an effort to address that person. Probably you need more training. Maybe he's not competent. Maybe someone need to evaluate whether he has the right competence to manage people. And so then the necessary action is taken on that person. You remember when I talked about the work dynamics, I mentioned of where the work content you may be underskilled, you may be overqualified, and so you are not able to deliver. So someone must be able to analyze that and be able to pick. And this is the modern workplace or workspace. The workspace look at what are the skill set you need. How innovative are you? How good are you in communications? They are looking at those soft skills because they may identify that's what you are lacking. And they may address the issue by that you need more training. And probably that will make you, and one of the training could be on mental awareness to make you less toxic by having the mental health literacy. So we must be very systematic. We must be informed by evidence. We must be monitoring and evaluating. We are not doing these things using our gut feeling. They must be very informed by the data coming from the program and informing the next level of planning and programming. And even the people who are doing the awareness must also be trained to be able to understand how systematically to come up with the policy plans, implement, monitor, and evaluate. And also other skills may be outsourced. They may not have all the skills. So there's that room of outsourcing for the skills which may not be within the work within the institution. Back to you, Diana.
Thank you very much, Daktari. Maybe Mary, you can pick this next question. Also, I'm seeing a lot of compliments about Mathare and people having come to Mathare for their attachment, for their practicum, and having learned a lot. Thank you so much for those comments. The question to you, Mary, is someone is saying, thanks a lot, Mathare. I was there for my attachment for 6 months, being a mental and psychiatric nurse, but ended up in the medical ward. I can recommend it being a great and a nice place to learn. My question is that your employer sometimes can be one of the people with a mental breakdown. Mostly that is what happens. How can I overcome this?
Then if I've gotten the, yeah?
Continue, Mary.
Or may I request Dr. Jugone to help me answer that one kindly? Dr.
Diana,
Jugone,
repeat the question, and then I can go ahead and answer it.
Okay. They're asking, the question is that your employer sometimes can be one of the people with the mental breakdown. How can you overcome this?
That your manager is having the problem, is having a mental health problem, eh?
Yes.
So yeah, that's a very good question, because they are trying to see how should I be able to address problems coming from and from my manager. As you mentioned, within the awareness program, the system is set that it should be able to handle the issues not only for the employee but also for the manager. Because remember, the manager is also an individual. He is also an employee. It's only he has been given that roles and responsibility to manage. Also, he has his own manager. Because as you see, there's a hierarchy or a system where you manage each other. So basically, the policy should anticipate for this and come up with a system. But then also we have people we call the mental wellness champions. The mental wellness champions are within the organization, and their work is to support, to direct. They are the ones helping to conduct the orchestra. You remember I said this is an orchestra. Sometimes even the services are not provided within the organization. They are provided from other outsourced providers who are giving you the various forms of services, whether it's general healthcare services, counseling, mental health services. So they are there. So if you are able to pick that there is a problem and you may feel like you are not able to approach your boss, they are the mental health champions who we put in place as an intermediary. They are like liaison officers to proactively see where there are problems or even to receive any issues, feedback from the other workers. And within their level of training, they can know how to handle it within the set policy and within the set strategic plan. I hope I've answered that question. There was also a question I saw from Joanne. Joanne was asking, just a minute. There are two questions I've seen. You can go ahead, Diana. You can ask other question as I look. The one
I
question
think
from
the question that you're talking about was directed to you. Maybe you can pick some of them. Hi,
I've seen it. I've seen it from Joanne.
Yes.
What are you doing with the manager in terms of their staff? Are there a program in relation to the HR in managing wellness without stigmatization? As I mentioned, that wellness is an aspect. It's like a profession right now at the workspace. This is beyond being a human resource professional. You could be a human resource professional, but you are trained now on these areas of workplace mental wellness. But again, also you may not work on this all alone. And that's why we emphasize the aspect about the committee. And there is a written plan with set activities, systems, structures, even protocols on how issues are addressed. Because you must have a protocols and operations procedures, a standard operating procedure. So we must make it very technical, very systematic. We must ensure that people are trained on how to address issues of wellness. And this may go beyond the aspect about human resource management. It brings a need of human resource management and an aspect about health. So as you can see, when it can't be handled by only one person. Joan is asking me what we are doing about manager in terms of their staff. I didn't get very well. So the plan must have what is the training required, or what are the capacity we need for the managers? What is the capacity we need for the individual employee? What is the capacity we need for the organization? So the people setting up the policy must be able to address those three areas. And as they're addressing those three areas, even the top management must also be approached as individual, as a manager, and whatever other role they play. So because they are also individual, and they must also be able to take care of their own mental health. And there must be program also to address prevention at that level in terms of their work. So we are looking at the work comprehensively. So the program must involve everyone. So you should not be manager telling people to go for about self-care and they're not doing self-care on themselves. It's not about managers talking to people about stress management or coping mechanisms, but they're also not doing the same, or they don't have the same skill. So it's working in all directions. So back to you, Dana.
Thank you very much. Maybe you could as well answer this one. Can MOH advocate for mental health to be included in PC to access funding?
Yeah, so I think this is very important. The Task Force on Mental Health did a recommendation that workplace mental awareness should be a key indicator in the performance contracting. And what is being looked at is before we have had this program in the workplaces where they could be addressing also alcohol. We had a program addressing HIV/AIDS, but now we are thinking about the human being in a comprehensive way. So beyond even just looking at mental awareness, we should be able to be moving from looking at disease specific to be more general towards the health awareness program at the workplace, so that they address all aspects about health. And so now this goes beyond just mental awareness, it will have all the other aspects. I think there's an effort towards this, but we are not yet there because there's some administrative decisions and directive to be made so that we can make it a performance contracting indicator. But I think that's the way we need to go. Good question from Elkana Nadwa.
Thank you, Doc. So there's a supervisor who is asking, there's a young man who comes to work at 9 a.m. every morning. Sometimes he absconds duty for days. He has such serious mood swings, and yet he is such a resourceful employee. And this supervisor is at the end of the tether. I feel like he has a mental challenge, and this supervisor has severally held his hand and walked with him through an employee assistant, and psychiatric intervention has been advised. However, this employee does not follow through. What can this supervisor do? He is a cardiac disease survivor, and so they feel sorry for him if he lost his job. He has never been abusive, but I really worry for him. What should I do?
Yeah, so this brings an aspect about that there's someone who has been identified having some health challenges, and there are levels of probably complications, or the recovery journey has had its own challenges. What the system should do, this wellness program should be able to anticipate that when we have medical problems, there are people who have complications, they will have impairment, they will may not be able to be productive as usual. So what do we do with this kind of a person? There's what is called, how do we reintegrate them? How are we inclusive of this person? And what are the reasonable accommodation strategies can we have on this individual? So I'll give an example. If you are involved in an accident, you have an injury to maybe a specific part of your body, let's say like your limb, your lower limb, and you get amputated. So probably to reduce that impairment and disability associated with that disease, it said the workplace must be able to address maybe disability inclusive. And there are a lot of psychosocial disability which do arise from mental health related problems and complications, where the recovery journey may have those challenges, and we may find how effective that person was in terms of their productivity has been affected. And so we must have reasonable accommodation to be able to integrate this person into the workspace. And probably by doing so, I will be contributing towards their recovery, because they feel well understood and they feel more accommodated, rather than where we are very punitive. So we should have all these necessary steps where we need to address these issues. There are people who may have complications arising from the health issues they are going through that may interfere with continuing with their work. Again, in such circumstances, there must be very humane way in addressing this person, especially if it gets to a point where they may be able to exit from their place of work. And probably maybe the good thing in terms of addressing their issues of health. You are not doing it on a punitive ground. You are doing it within a well-set program, and they assist the government levels addressing some of the health, and where an individual may not be able to continue providing services, it must be with a lot of respect in which they can have a livelihood or an income generation in their life. So there are the issues at various levels of complexity. All of them, we must them. I hope I've tried to answer that question.
Yes,
including even compensation, where we may need to compensate people for the rest of their life. We must have, as an organization, we must anticipate that those are risks within our workplaces. And if they happen, what we do, where someone may no longer be able to provide services because of various medical complications.
Thank you, Doc. Maybe you could as well take some 2 questions. I'll combine 2 questions. Hello, some of those who work in counties facilities do suffer burnout for sure. Lack of annual leave days, delayed paychecks, lack of motivation at the workplace, shortage of personnel, and as such, output is low. How do we then enable our supervisors and county governments to understand this part of health in order to increase overall productivity? And also the second question, debriefing should be factored into the SRC scheme of service as a self-care for all staff, and mental health practitioners be given non-practicing allowance.
Yeah, so I see this question, especially the one from Elizabeth on facilities where people are having burnout, they don't have annual leaves, delayed payment. So here we are identifying some risk factors which are related to the work dynamics. This situation analysis, as Elizabeth is laying it out, that there are aspects around workload, the remuneration, trainings, shortages, and all that. Then once you're able to conduct an assessment in an institution and you are clearly able to identify, you do some questionnaires or other methodology of doing the assessment, then you should be able to go to the management, the committee, and say, this is what we have identified within the work dynamics, and this could be risk factors to the awareness of the people here, and it could also interfere with their productivity. So what are we proposing as a strategy to address what we have seen within our quick situational assessment? And then that is put on the ground, and then they say this is the cost. So what we are encouraging is a systematic way of doing things, and that's why we have these guidelines. And for us to start doing that, first we need to educate people as we disseminate these guidelines. The first thing we need to do as the people who are within the mental health space is to educate people within various levels of the workplace, whether it's the top management, whether the policy makers, to understand what we mean by mental wellness at the workplace. When you find the WHO finding it necessary to put it as the key theme for the next 3 years, World Mental Health Day, is because, as I said at the beginning, the reason why we have said that it's such an important thing, 60% of the adult population are at a place of work. Again, if you look at the total days of your life, the days you spend at your workplace are the majority than the days you are in school or the days you are in your old age. So then, for all purposes, it makes the most strategic reason that this should be our focus. So like the way we are saying, we need to focus at the community level. We have also realized another big community is a place of work, and that's why we need to find people. So right now, what I would say, before even people have this understanding and see the benefits of putting resources here, as I said in the beginning, that this profitability of your organization. So there's a long way to go. I will not say it's very easy. We need to educate people, the people in government, the policymakers. We need to educate people within the work institution, both public and private. We need to educate people all the way from when they are very young in primary schools, that these should be some key elements in some of their curricula. They understand how work can contribute to someone's good mental health and how work can be a hazard to their mental health and what can be done. This is by evidence. There are many studies. I didn't go to quoting the various studies which have been done around this area, but a lot of studies have been done, and there is overwhelming evidence that what work does to people's mental health and what mental health does in terms of making work better and what can be done on this. So I think we are at early stages. Even if we have these guidelines, a lot of dissemination, a lot of capacity building, a lot of awareness creation until we get to a threshold in terms of the momentum on this agenda, that we can start making it as something very routine. That there is no organization which doesn't have this as part of, their key areas of investment. Back to you, Diana.
Thank you. So we can pick around 3 more questions because I can see our time is far gone. Are there specific training programs or workshops that could be beneficial in raising awareness about mental health issues and building resilience among we as students on attachment and also staff members at Mathare National Teaching and Referral Hospital? And secondly, is there a first aid protocol for mental health?
Protocol. So basically what I need to say is that we are trying to change what we have known Mathare as a facility in the past. We want now to focus on the area of training. Focus on this will be to provide capacity building and technical assistance. And so those who, Mathare being one of the institutions collaborating with many medical training colleges and universities, you'll be able to get these opportunities and get this kind of training. It's work on progress. We are at the initial stages of setting up this. You asked whether there is a first aid protocol for mental health. The psychological first aid is highly recommended for people going through a major psychological crisis. It's there. We can provide the necessary training. Most everyone, any healthcare worker should be able to have this training, just like the way we have first aid training for other medical condition. So we should be able to train people. That document is there, provided by the WHO, and I think that's it. So we also we understand for Mathare to get to where we want it to go, to be a parastatal providing services at a tertiary level, we must also build services at the community and primary care level. So Mathare also will be working very closely with the counties to ensure that they have where they have the capacity to provide mental health service at that level, so that we can reduce the road of people coming from across the country to just seek for mental health services at Mathare, when the same thing can be provided within their primary health care facilities or their county health facilities. We want to leave Mathare to deal with more super specialized services rather than addressing primary health care. So Mathare is cognizant of that, and it needs to work with the counties to ensure that they are able to have the services there. So that we reduce the workload, and then Mathare can focus on its key mandate.
Thank you, Dr.
So that's it, Diana.
I wanted you to answer this last one. That are there any systems that have been set up to handle mental health conditions of people in the informal SMEs and Jua Kali workplaces? Maybe you can answer that, and then I'll hand it over back to Memphis.
Yeah, those are very good questions. Basically, as we said, these still are workspaces where people are working within the Jua Kali sector. And as you heard, I'm saying workspaces because the spaces may be even virtual. And so basically, when we disseminate these, we want to have even people working at the community level who are interacting with people within those spaces. They have the necessary skills. The community health promoters will also need to be trained on how they can be able to train people within this informal sector to understand aspects like about self-care. They can understand about the environment, how they can set up an environment which is mental health friendly environment when they are working. And basically things like even noise pollution interferes with people mental well-being. So if you have someone who is providing this information and talking to the people, that if you work in an environment where there is less noise, it's good for your mental health. If you work in a space where there is good ventilation, it's good for your mental health. If you work in a space where there is the security, that you don't have to work, fearing about your safety and security, then it's good for your mental health. So it's very practical, and focus should be on promotion and prevention. I emphasize again, most of the program currently we have, they are focusing on when people fall sick. We need to move away from that to where we have programs focusing on promotion and prevention. Back to you, Diana.
Thank you very much, Doc, for answering the questions and also for leading us through the webinar. And also thank you so much, Mary, for sharing your knowledge through the webinar. I'd welcome Memphis, who is the moderator, to maybe hand it over to Kenyatta to formally close. Memphis?
Thank you very much, participants. Thank you very much, Dr. Thank you, Mary, for the great presentations. I think we will stop there. And in case of any questions, then we are available at Mathare. You can even consult in Kenyatta and you will be assisted. I take it back to Nelson. Nelson, kindly close for us. Thank you.
Thank you once again to our panelists for the wonderful session. We have learned a lot. We are looking forward to more and more sessions like this. To our participants, thank you as well for showing up today and also being part of this discussion. We will be back tomorrow at 2 p.m. with us with our World Patient Safety Series. And this time we'll be looking at diagnosing children and what challenges and solutions we might have in healthcare quality. Thank you once again. Do have a wonderful evening.
So thank you, everyone.